We are learning more about Congresswoman Giffords' gunshot wound tonight. Doctors say the bullet entered the back of her head, then traveled through the left side of her brain, exited above her left eyebrow. Now, one of the reasons doctors are guardedly optimistic about her recovery is because the bullet did not harm the right side of her brain, meaning brain swelling caused by the wound is confined to the left side. Now, most people who are injured the way the Congresswoman was do not survive this kind of wound. Those who do face a long recovery. With us now is Dr. Kritis Dasgupta from the Brain Injury Program at the National Rehabilitation Hospital, also an assistant professor in the Department of Rehabilitation Medicine at Georgetown. Doctor, thank you so much for being with us and helping us kind of make sense of all this. First, I have to ask you, doctors, there was a report that came out this afternoon. Doctors seem to be optimistic because she gave them a thumbs up. Based on her actions today, her reactions, what does this tell you about her chances for recovery long term?
It tells us several things, Laura. I mean, we do have reason to be guardedly optimistic because we know that she is out of a coma and, in fact, out of a vegetative state. So we know that she was able to respond and follow simple commands, even in the ambulance on the way to the hospital. And now, after surgery, the last report is that she was able to hold up 2 fingers on command. So the prognosis is certainly better for patients who are able to respond to this level this early on after their injury.
And I'm wondering if those first moments following the injury, if those are the key critical moments, and especially you heard Sean talking about the intern's actions. He held her head up, he kept her talking, kept her reacting. How much did that, what kind of part did that play in where she is today?
I think it certainly could have played a part. I think what is probably most important is that she was in the operating room 38 minutes after the shooting occurred, which is very, very impressive. And so I think all of those things certainly are helpful for her overall prognosis.
What is the key to her recovery now? How soon will we know the damage?
Well, at this point, it's too early to say. We are looking at a recovery period of weeks to months or even longer. So what we would be looking at is, right now, the neurosurgeons are very carefully watching her for any sign of swelling, seizures, infection, or any other medical complication. Once she's medically fully stabilized at the Tucson Medical Center, she might be transferred to an acute inpatient rehab hospital where she would have a whole team of rehab specialists, so physical, occupational, speech therapy, and rehab doctors and nurses who are specifically trained in traumatic brain injury, the goal being to get her functionally as independent as possible.
I guess this is best case scenario given the situation. Dr. Dasgupta, thank you very much for being with us and laying that all out for us. We'll be watching this as it develops.